In this lab, we will be continuing our discussion of the muscles of the trunk. We'll focus on the posterior muscles of the trunk. We are on our second column of the muscle practical checklist, about halfway down. So this is an overview slide. These are the muscles that we're going to look at in this lab. Just to kind of give you an idea, a couple of reminders. The muscles on the right hand side on this model happen to be all superficial muscles. So these are the muscles that would be closer to the surface. And if you notice, the left side does not look like the right side. That's because the superficial muscles have been removed and we are seeing the deeper muscles. There are other muscles that are not visible on this model, but we'll mention some of them. But these are the ones that we're going to do. The way I broke down the muscle checklist is the first muscle we're going to do is going to be a muscle called the latissimus dorsi. This is an interesting muscle. It's located on the back, and that's why we're covering it here. But functionally, it's an arm muscle. It moves the arm. Then we'll take a look at four muscles, actually five muscles, but I put it down on our list as four. Four muscles that move the scapula. So these are going to be muscles that are attached to the scapula and move the scapula. Then we'll take a look at the remaining muscles. Those are going to be muscles that move the trunk, right? They're more like our postural muscles. They tend to move the torso. Now I divided that up into three layers. We'll take a look at some of the muscles that are superficial. Right? If we were doing dissection, let's say, on a cadaver, we would do the superficial muscles first. As we reflected them back, we would see some muscles in the middle layer. Right? In our notes there, I put it down as intermediate layer. And then finally, as we got closer to the actual spinal column, we would see the deep layer. So let's begin with the first muscle. This is a muscle, like I said, that is located on the back, but functionally it's an upper extremity muscle. It's going to move the arm. This is called the latissimus dorsi. A lot of people just call it the lats. Now, this muscle you can see starts way down over here. This is called the thoracolumbar aponeurosis. It's just a broad, flat tendon. Then the muscle goes up along the side of the chest, under the axilla, through the axilla, and then it comes out on the front of the arm. It actually attaches to the medial lip of the bicipital groove. Right? So it's actually going way to the front of the arm. This muscle is actually a very powerful muscle. It does extension, internal rotation, and adduction of the humerus. The next four muscles are going to be the muscles that move the scapula. So we can see on the superficial side there's a big muscle. It's right underneath the skin. It starts way up here. It kind of comes out to the acromion process and then way down over here to T12. And you can see it attaches all the way along the spinal column right here, the spinous processes. This big muscle is called the trapezius. Now we can divide the trapezius into three sections. This is the upper trapezius, where the fibers are kind of going straight across. This is the middle. And then when the fibers are going down like this is the lower trapezius. As a unit, the trapezius is a good adductor, excuse me, as a good retractor of the scapula. If you were to just kind of take your shoulder blades and bring them back together, all of these fibers here are going to take the scapula and pull the scapula towards the spinal column. All right, and that range of motion is retraction. Some of the other things, if you went to the gym and you did some shoulder shrugs, you would be contracting these fibers up here. So this would be actually elevation of the scapula. The middle traps pretty much just do a retraction, and then the lower traps can also do some depression where they bring the scapula down. But as a unit, think of the trapezius muscle as doing retraction of the scapula. The next muscle we want to take a look at is actually in front of the trapezius muscle. So we can see it here. It's actually right in front of the upper trapezius muscle. We have to go to the deep side to see it. This muscle is called the levator scapulae. Right? The name tells us what it does. There's really nothing to memorize, right? It's going to levate, which means to elevate the scapula. So again, if you do a shoulder shrug, that would be the action. Right? A levator scapulae. Right below the levator scap is two muscles. These two right here. They attach right along the vertebral column here, and then they go over to the medial border of the scapula. So kind of pull the medial border away a little bit, but they would attach right along that edge there. When these two muscles contract, they are also going to do retraction of the scapula. So if we look at the muscles, the trapezius was a retractor, and the rhomboids, which are just underneath the trapezius, they're retractors also. These would all be synergistic muscles. The trapezius and the rhomboids, they work together to bring these scapulas into retraction. So far we have the trapezius, right, retraction of the scapula, levator scapulae, elevation of the scapula, and then the rhomboid minor and the rhomboid major, right? Minor just means that it's small, and the major just means that it's bigger. Right? It looks like one muscle, but it's actually two muscles. The last muscle that moves the scapula is the serratus anterior. So I took this photograph so that we're kind of looking at an anterior lateral view of the chest, and serrated means jagged. So if you take a look over here, there's kind of like this jagged edge right here that kind of goes along the ribs. All of this here. This is the serratus anterior muscle. So it starts on the lower 8 or 9 ribs out here. It goes up, it goes around the torso, all right, around our chest, and it goes to the underside of the scapula, and it actually attaches to the medial border of the scapula. When the muscle contracts, it pulls the scapula forward, right, this way. So from say the scapula was back here where my arrow is, it would actually pull the scapula towards the front. So that motion is called protraction. Right? Protraction is the opposite of retraction. So you could think of this muscle, the serratus anterior, as an antagonist muscle to, let's say, the rhomboids and the trapezius muscle that we just did. All right, so serratus anterior, you're going to find it on the lateral aspect of the chest. Going to have a jagged appearance to it, hence the name serratus, and it is a powerful protractor, and that brings the scapula forward. So those are our 4 muscles that move the scapula. Finally, the last muscles we want to take a look at are the muscles that move the trunk. So if you go back to my practical checklist, you'll see the first layer I have for you is the superficial layer. Again, if we were doing dissection, these would be the closest to the surface of the body. You'll notice there the first muscle we'll see, and then the next 2 muscles we don't see. On these models, they're covered up by some of the more superficial muscles. So these we're just going to learn by name, but we won't be able to identify them on the model. And then the 4th one we will be able to see. So let's take a look at the superficial muscles first. The first muscle I actually had mentioned in our first part 1 of the trunk is the splenius capitis. So this muscle attaches to the lower cervical spine right over here, the spinous processes, and then it comes up all the way over here to the mastoid process, like right about there. This muscle, when it contracts bilaterally, meaning the left and the right were to contract, it would pull the head and the neck backwards, and that would be extension of the neck. If one muscle contracts, let's say on this model here, we only see the left one, if the left one were to contract, it would cause rotation to the left. So we say that's either same side rotation or ipsilateral rotation. Right, so that's the splenius capitis. The next muscle on our list is the splenius cervicis. That one we don't see. It's kind of under in here, so we don't really visualize that one. That would also extend the head and the neck. The next muscle is the serratus posterior superior. That muscle would be under the rhomboids, so we don't see that muscle either. So we'll just kind of know that one by name. But the one that we do see way here at the bottom, This is another serratus muscle. See, the serrated has the jagged appearance. Right? So whenever you hear serrated, look for a jagged appearing muscle. This muscle goes to the lower ribs. From the spinal column here, it goes up and attaches to the lower four ribs. When it contracts, it pulls the ribs down. So we know from the muscles of respiration, when the ribs go down, that is exhalation. But normally during quiet exhalation, quiet breathing, we really don't need any muscles. So this here would be when we have to force air out. So you could put down as an action, this is going to do forced exhalation. You know, they're synergistic with the internal intercostals that we did in the previous lab. Okay, so these are the two muscles out of four that we can see on the superficial layer: splenius capitis, serratus posterior inferior. Here it is on the head and neck model. Again, splenius capitis. We can see it here. We catch a little glimpse of it over here too. The next muscle is actually a massive muscle. It's a muscle that has three columns. It's a muscle that each column is broken up into three sections. So it's actually 9 muscles, and we call it the erector spinae group. This muscle would be found underneath the superficial muscles. So the models that we have in the lab don't show the entire erector spinae group. On our torso model, we do catch a glimpse of these fibers running straight up and down over here. This is actually a part of the erector spinae group called the longissimus thoracis. I'm going to just have you identify it as the erector spinae group, but this is just one part of this massive muscle. So the erector spinae group, the name kind of tells you erector means upright, spinae, the spine. So this is one of our very important postural muscles. These are the muscles that keep us upright as we bend forward, say to do some type of procedure or something. We're kind of leaning forward. This is the muscle that's contracting to keep us from falling flat on our face. So again, this is just a small glimpse. If you take a look in the lab book, you'll see how extensive this muscle is. All right, so you can identify this just as the erector spinae group. If you want to be specific, it would be the longissimus thoracis, which is just a part of the erector spinae. Finally, going back to our checklist, so you'll see the remaining muscles are called the deep layer. There's a group called the transversospinalis group, which means that these are kind of short muscles that run from the transverse process of one vertebrae to a spinous process of a vertebrae above or a couple vertebrae above. So again, we see some but not all. The semispinalis capitis we're going to identify. I had already looked at that in the previous video on the head and neck model, but we'll review it again. We will not see the multifidus, but we will see the rotatory muscles. Then we'll take a look at the segmental muscles. Again, I'm just kind of looking down our checklist first before we look at the actual video or the actual model. The next group will be the segmental muscles. These are muscles that are between two adjacent vertebrae. So we're going to see there's a muscle called the interspinalis. The name tells us where they are, right? They're between these spinous processes and then the intertransversarii, which are going to be between the transverse processes. So let's take a look at those. We'll look at the transversospinalis group first. The first muscle, like I said, we had already identified in the head and neck video that we did. This right here, and again I labeled it over here, is called the semispinalis capitis. So when this muscle contracts, it will bring the head backwards. So if you were to kind of like look up, just kind of tilting your head backwards, your semispinalis capitis is going to be contracting. Even just holding your head upright so that it doesn't fall forward, your chin onto your chest, this muscle is contracting just to kind of keep our head upright. So we look at it as a postural muscle. So that's the semispinalis capitis. Right? Like I said, we had done that once before. Here it is on the torso model. Same exact location, right? Different patient, just same muscle, just on a different model. Okay, so the next muscle we can see are the rotatories. This muscle right here is the rotatory muscle right here. This is actually going from a transverse process would be about right here. I'll actually show you up over here. This is a transverse process, and then here's a spinous process. So the rotatory would be running from a transverse process to a spinous process. Here's another transverse process. They're kind of running that way. So this is the rotatory muscle right here. When this muscle contracts, it does rotation, right? So it does rotation. So these muscles will be running all up the spine like this between transverse and spinous process. Here's a muscle that we could consider one of the muscles of respiration. I didn't put this on our checklist, but this is a muscle called the levator costarum. You don't have to know it for my practical, but since I have it here and I labeled it, I'm going to show it to you. This one's going from the transverse process down to a rib. So when it contracts, it pulls the rib up. So that means it would do inhalation. Inhalation, right? Whenever we raise the ribs, we're going to be breathing in. So the muscle here, I do want you to know, running from the spinous process and the transverse process, a short little muscle right here is called the rotatory muscle. This is a model that does show, we only have one model that actually shows the segmental muscles. So what we're looking at here is kind of like the lumbar spine. You can recognize that because here's the sacrum, L5, L4 spinous process, L3. So between L3 and L4 right here, this muscle right in between the spinuses is going to be the interspinalis, and they run all the way up right to the cervical spine. So we will see that pretty much at every segment for the most part. They're not that well developed in the thoracic spine, but they do run up all the way between the spinous processes. So when these muscles contract, they're going to bring the spinuses together. This means that they will contribute to extension, right? They're going to bring the trunk backwards. This muscle here, this is the transverse process, transverse process. Now we can catch another transverse process over here. So this muscle going up between the transverse processes is the intertransversarii. So when they contract on one side, they're actually going to tilt the spine to one side. We call that lateral flexion, right? So we just kind of do side bending to one side. That's known as lateral flexion. The last muscle for this lab is a muscle that we see best from the torso model, but looking at it from the anterior, from the abdominal cavity. This is called the quadratus lumborum. So you can see here, this is the 12th rib, extending from the 12th rib down to the iliac crest. So this white bone over here is the iliac crest. This is the quadratus lumborum. A lot of times people just say the QL, and you can see it over here also. A lot of back pain comes from quadratus lumborum. So this is a muscle that when it contracts together, the left and the right contract, will cause extension of the spine. But if one side just contracts, it actually lifts the pelvis up, and we call that a hip hike. Right? So say you were holding like a baby and you kind of put a baby on your hip, your child on your hip, and you kind of lift your hip up a little bit. That's what we call a hip hike. Right? So this muscle is the quadratus lumborum.